So let me just start at the highest level mission of why we exist. We started this company with the idea of exercise being medicine. This is something we all know. This is something we talk about. But my partner and I asked, how can we actually enable the rubber to hit the road of not just exercise being medicine as a buzzword, but how can we actually steer medical dollars? How can we actually help, frankly, everyone on this call who's on the front line of health? We believe, and our mission of our company is you guys are much more on the front lines of promoting health, promoting wellness than hospitals, which we think are a sick care system. I mean, you guys are actually fighting, for people to stay healthy. And as a country, we have to steer, in order to get out of this crisis of chronic disease that we're in, medically advantaged dollars, tax advantaged dollars, our 4 trillion we spend on healthcare away from this sick care system where it really basically manages diseases once people get sick and to keep people healthy. And that's what we started with. Okay, great. That's a high level mission we're all aligned with. What we're really excited about and what we have found is that there's a powerful tool to steer medical dollars to exercise in the FSA HSA program. Let me just pull up some slides here, and I want to give you a little bit of an overview of why this is a pretty powerful program. So about 80% of the American people qualify for having an HSA or an FSA. You might have heard of these accounts, you might have used them, but essentially when you're choosing your health insurance, you can elect for tax advantage dollars to be in a separate account for medically qualified spending. So for next year, it's going to be up to $10,000 per family can elect to have that pre-tax money in their accounts. So it's about 80% of the American people have access to that. We've got almost $140 billion right now sitting in those accounts, very under-optimized. And again, as I said, this is actually going up a lot next year, up to 10,000 for HSA. And about 40% of your customers, we'd estimate based on our analysis, have a funded account right now. Okay. So this is a pretty widely used program. But as you might have heard, and frankly, I very rarely use these accounts in the past because it's known as money for when you get sick. Qualified medical expenses are thought of as something that is something that's like once you get heart disease, once you get diabetes, to buy drugs. What our core understanding and our core insight as a company is this, that if a patient has a doctor's note explaining how exercise specifically can reverse or prevent a condition they care about, then that unlocks exercise for HSA, FSA funding. So a big learning and a big unlock here is that doctor's note can be for prevention. So about 65% of the American people, tragically, I think, have a chronic condition. Those are exploding right now. But even if it's not the 65% of people that are battling with, prediabetes, insomnia, depression, anxiety, fatigue, chronic fatigue, things like that, the vast majority of people are working to prevent something, are at risk for diabetes, heart disease, things like that. So if you have a doctor's note, again, tying exercise to tying exercise to the reversal or prevention of a condition, then that unlocks FSA, HSA spending that they can use at your studio. This is something that we learned about from our hero in this space, Dr. Mark Hyman, who you might have heard of, a functional, kind of the godfather of functional medicine, who's written a ton of books. He said many times that if exercise was a pill, it'd be the best-selling pill in the world. Many functional medicine clinics on a micro level do write letters of medical necessity for exercise. And what we're trying to do at Truemed is just bring that very widely. And what we're doing is using telehealth laws that were really expanded post-COVID, that frankly have been used to easily prescribe a lot of pharmaceutical products. We asked, can we use those same regulations to prescribe exercise? And it turns out we can. So that's high level what we do. High level, what Truemed is a seamless way for you to enable your customers, if qualified, to spend tax advantaged money at your services. So I want to go quickly into our implementation here, which we designed to be no cost to you and about 5 minutes to set up. I know you guys are busy. Just as a point of reference, we've tested this with CrossFit affiliates. And right now, over 25% of CrossFit affiliate owners are using Truemed, driving significant incremental customers and retention on their existing customers by signing up gym by gym and using this. So I want to walk through the exact same process that we tested with CrossFit and a couple other large entities that we think works really well. So let me just share my screen here. Mm-hmm. So truemed.com/BFS. This is for you, the studio owners. And basically, we've got a lot of stuff here, but we've got about how we increase sales and retention, some steps here, which I'll walk through, you know, that quote I mentioned from Mark Hyman. So you got some information. Again, this is not for your customers. This is for you. And you click here, get started. And I'll just do a test here. You can sign up. This will be the public facing name. So I'll just sign up. I'll do this. Your email that you want to get correspondence to. This is internal. So your name and then a password. And then you click sign up. So this creates a custom account for your gym, studio. The next page, you get a link here. And this link is your telehealth link to give to your customers. So you want to think about this link as you can merchandise to them, and we'll go over some ways to do that. But this is the required step of them taking, and it's just a 3 to 4 minute survey where they outline conditions they're working to prevent or reverse. And if they can identify, as most Americans do, issues that they're trying to prevent or reverse, we are able to review that information and quickly issue them a note and reimbursement instructions. This, again, is applicable to, we'd estimate, about 40% of your customers who have an HSA, FSA. And it's, again, a 3 to 4 minute survey and then seamless instructions where they're able to then reimburse their payments for the next year to you with tax-free dollars. So that represents a 30 to 40 to 50% savings, depending on their tax rate, for the next year. And the goal, again, is really just to share this out. Once you sign up with us, you'll be receiving emails where we can give social media templates, give suggested emails, but this absolutely crushes it, particularly with current subscribers. You can imagine emailing your current subscribers. And again, we give an email templates and we'll follow up immediately with a number of tips. But just sending an email, letting your current subscribers know that future payments with Truemed could be qualified. They could reimburse and effectively get that 30, 40% savings. We're seeing substantial increases in retention. And then, you know, your prospective customer lists, as you're speaking to customers in the studio to potentially sign on. This is a very nice thing to mention about the ability for them to unlock their HSA, FSA funds. We will be sending you, anyone who signs up also, you can obviously opt out of this or not use them if you don't want to, but we'll send you pamphlets as well that you can hand out, you know, that just explain to customers in the studio how they can save with HSA, FSA dollars. So that's pretty much it. It's going to truemed.com/BFS, establishing your custom link here. Again, this will charge the customer. So it's no payment. This is a way to enable, you know, more business to you guys. It charges the customer $30 at the end of the survey for the telehealth evaluation. For the customer, they'll make that back by spending just $100 in the year with you, because assuming an average tax rate of 30%, a lot of people are higher. But that's how to think about it, and that's how to think about the savings. So if they're on a, you know, monthly plan, they'll make that back, you know, within the first half of a month or a month, you know. So it's a very clear value proposition to customers. We handle customer support on reimbursement or any questions, but for anyone with an HSA, FSA, this is a pretty clear value proposition, and frankly, something that seems to drive a lot of excitement among members of gyms and studios. So that's how it works. Want to make sure I've answered every compliance question, every process question. This whole process rests on an independent determination by providers that are on our side. And you're able, you know, the compliance here works because you're not making any medical claims. You're just facilitating asynchronous telehealth intake with us. where our provider makes a determination. So I can't speak for every determination a provider makes. I could just talk high level what our philosophy is. But something I kind of think is amusing that we go back to a lot is the American Heart Association, which is funded by pharmaceutical makers, not to get too conspiratorial here, but they've issued guidance that every American adult should be on a statin because we have such a metabolic health crisis. We agree with the second part that we have a metabolic health crisis, but we actually think the science says every American should be on an exercise prescription. So, our net is very wide, and the IRS is very clear that that you can make a note for something if there's evidence that it can reverse or prevent a condition. And the vast majority of people, it's over 98% of Americans, based on our surveys, are have a condition they're working to prevent or reverse. So generally, if someone denotes something that we can tie science to exercise. So to answer your question explicitly, it's 1 to 2% of people who say they're perfectly healthy, not trying to reverse or prevent anything. They would not be accepted. In reality, that doesn't come up much, and I don't think is going to be an issue. I think it's generally, you want to give this link to folks, say that we make our own determination, but not promise anything, but if they are working to prevent or reverse something through exercise, generally that's accepted. Again, going to our mission of driving medical dollars to exercise, this is the biggest pot of money there is. This, again, 80% of people have access to an HSA FSA. About 40% have a funded HSA FSA. So we're trying to be really targeted here. So you might have people say, oh, I'm on Medicare, or I'm on, have insurance that doesn't have HSA FSA. That's, I think, going to be rare, but the answer to them is that Truemed is working to enable as many programs as possible, drive money to exercise. They can sign up with us and we'll keep them updated, but we are laser targeted for the near future on unlocking HSA FSA. My general stance there is that as you're talking to your members, and I've heard this a lot from our CrossFit gyms and other folks who've been testing this, if somebody's confused, they probably don't have one. So you want to tell them that open enrollment's most likely coming up, and they should ask their healthcare administrator, their HR lead, whoever handles their healthcare, whether they have access to an HSA FSA. Most likely they do. And that's really positive because you can actually educate the folks as they're choosing their health and re-enrolling in their health at the end of the year. They can then commit money for next year, planning to spend with you. So it's actually a really, really good time. Again, just to underline that, people are choosing their contributions right now for next year, so they can plan out their spend to you for next year. And once you contribute, say, $2,000 into the FSA, you get that money. They get that money day one. They get that money January 1st, but it pulls out of the paycheck all year. So it's essentially like a tax-free loan. It's very beneficial in many ways. So that's really what you want to do. If there's confusion, tell them to check whether they can contribute for next year to their HSA FSA. To be approved for Truemed, as I said, it's denoting whether they're trying to prevent or reverse a condition, which is the vast majority of people. As far as whether they qualify for an HSA FSA, the majority of Americans do for an HSA or FSA. And you'll just, it's a wide enough pool where if you promote this to your groups, you're not going to piss anyone off who doesn't have one, because it's a pretty known entity. It's kind of just ignored, but the majority of people do have access to one, or have a funded account right now. We have, you'd think probably this is unnecessary, but we have hundreds of studies compiled. And this is what we did for a year before we started this company. We actually went through the research, and for every condition, whether it be diabetes, obesity, depression, heart disease, there is specific research on yoga helping to prevent or manage those conditions, both from the physical movement aspect and even the stress reduction aspect, which is highly tied to metabolic health and the underlying causes of most chronic conditions that are plaguing Americans right now. So we are evangelical about yoga as medicine, and absolutely, we'll have our whole team is proponents for that, and yoga definitely counts. The heuristic for us is like you're walking into, I don't know if you guys follow Mark Hyman, as I mentioned, one of our advisors and really inspirations on this. You walk into a really smart functional medicine doctor's office, what are they going to recommend and put their weight behind? What are they going to put in that note that is going to help that person prevent or reverse disease? So it's yoga, it's group classes, it's personal training. If you guys sell supplements, you can email us. We can try to add those to the notes on core supplements. That's what we do. This is something we're looking for guidance from the individual studios on. But if you, for instance, add on nutrition coaching, add on supplements that you sell, we generally are able to approve high quality, like core up the fairway supplements like protein supplementation, creatine, which there's an increasing amount of evidence for on a number of conditions, vitamin D, like omegas. Let us know. We could specifically add, we could vet and add specific supplements you sell to your letter template. Because what the customer needs is they get a letter substantiating what counts from us, and then they're able to reimburse either through a manual way that's very quick, or put the payments to you on their HSA card, which we help the customer with. So if you have specific additional services other than exercise you'd like to have considered added, shoot us an email after you sign up. You'll get an email from us, and shoot us an email. It's team@truemed.com. And then we can work with Tiffany to edit the notes if we can improve those items. Generally, that all of the above: unlimited, year pay in full, class passes. There are some HSA FSA administrators that kind of try to match the timing. So the TLDR, the kind of high level, is that FSAs are very attractive to potentially giving your customers a discount to get money up front, because the customer doesn't care when they spend the money. They have it in their account sitting there. So it does actually, I don't know if you're getting to this, but it does actually potentially work for a cash flow kind of improvement situation for you guys. What I would recommend is signing up with us, doing some messaging around Q4, funds expiring, people planning for their contributions for next year. And then if there's appetite for your members to like contribute for next year, and then January 1st, like prepay for the whole year, things like that, I would choose an email. We can strategize on this, make sure you're messaging it in the correct way. But that should all count. But yeah, body composition scans and kind of the quantified self is a vertical that we support, and body composition scans would definitely count. So the funds are running out, and I just want to highlight that, guys. HSA, this is where it gets kind of complicated. The HSA accounts are the majority of money and don't run out. And then there's this FSA, which is very similar, but they expire, and billions of dollars expire at the end of the year. So that message of, and we can send you again email suggestions on this, but messaging that you can use your expiring funds as the year ends, either prepaying or either paying for the future is good. We can't give guidance on retroactive reimbursements. We can promise, and this, somewhat works for your business too, because it really is an incentive for people to pay going forward, for like prospective customers to get over that ledge to reimburse and like pay, and for subscribers to keep subscribing. So we can guarantee future. It's really at the HSA FSA administrator's discretion on backwards looking. We say, folks are, free to try to reimburse previous. We do not guarantee those, and our letter is dated for the year starting on when they take the survey. So generally, we want to frame this as a forward-looking thing to drive you guys forward-looking business. So I started my career actually in politics early on, and before we started, for about a year, I met with 40 members of Congress. So this is Cory Booker. I had a talk with Dan Crenshaw, as a representative from Texas. This is a senator from New Jersey, Republican, Democrat. And then our first investors and advisors, one of them was Senator Bill Frist, who was the former majority leader. who's a heart surgeon, Dr. Mark Hyman, who I mentioned. These were two of the four chairs of the White House Nutrition Conference. Here's us meeting with a number of members of Congress, writing op-eds with members of Congress. So we did a lot of diligence on this. And we had the same question: why the heck hasn't this been done? And what we learned, I think we stumbled on a couple of things. First, it actually is being done. So Mark Hyman, as I mentioned, is doing this in his clinics. If you go to a functional medicine clinic, you might get a note for exercise or food interventions. But why isn't this done widely? I go to my sister. My sister went to Stanford Med School, kind of was a surgeon, residency on the up and up on the whole medical school track. She did an analysis. 90% of her classes at Stanford Med School were on pharmacology. Not a single nutrition class she took. Not a single class on exercise. 90% of doctors today graduate without a single nutrition class. And literally the vast majority of their course load on pharmacology. She at Stanford Med School did not learn how to write a letter of medical necessity for food or exercise. She learned how to write prescriptions. So I really do think there's a blind spot in the medical system in total, where doctors do have an algorithm where they're prescribing more of a sick care system and not trained to really go deep into dietary interventions or exercise interventions. And we think that's a huge problem. And I think that is a factor why this isn't widely. If doctors were, not to get into the soapbox too much here, but if doctors were following the science, everyone that's coming in with a chronic condition, which is 80% of deaths and more than 90% of healthcare costs, they'd get an immediate letter of medical necessity for exercise. Not to get too in the weeds here, we have a lot of strong opinions on this, but that's not profitable for the medical system, and it doesn't happen. So we have affirmed this with the IRS, with the White House, with members of Congress who oversee HSA, FSA. Actually, folks we have been in touch with and been in close collaboration with at the IRS actually issued new guidance. They actually issued just this year. This is on the IRS from this year. Is the cost of a gym membership a medical expense that could be paid for or reimbursed? Yes. But if the purpose is to treat a specific disease diagnosed by a physician. So we worked with the best telehealth and digital health lawyers in the country and created our process, which is a digital intake to receive that letter, which is required here by the IRS to reimburse gym memberships. That's what we followed, and we did this in collaboration with the IRS. We are very proud of, I think, being a trendsetter in this market to tie the insights we've gotten from Mark Hyman on a micro level to use telehealth laws to be compliant with this IRS guidelines. And we have been, I think, trailblazing. We now have copycats, which is great. I mean, we hope this market grows. And I think you will be hearing more and more about it. I think our hope, obviously, as a company, is really to expand this market, and I think you're gonna start hearing. We're working with really industry-leading brands like Thrive Market, like Athletic Greens, like 8 Sleep, Future personal training fitness program, CrossFit, as I mentioned. So, very, very proud to be working with you guys. So hopefully you guys are trendsetters in this, and we'll be hearing a lot more about this in the coming years. But just as far as a practical matter, we take all risk and take this really seriously. I mean, our team is best in class. I think all mission-based, devoting our lives to this. Our team has raised $100 million for previous ventures, and is really doing this to have a dent and doing this the right way. It's not even an interpretation of the law. This is what the law says, and we want to partner with the best studios, the best fitness outlets, and really, really have a mission to change healthcare, to make this not so subtle. Make this like the clear place where the medical system goes when we're thinking about the first line of defense to preventing chronic disease. All right, that's my rant on that. The customer pays $30 at the end for the medical consultation, and they make that money back quickly as they're able to reimburse. So the customer pays us $30. We use that to pay our doctor, do our compliance work, and make money from that. Hopefully you guys have seen by now, we really are on a mission to enable you guys. We really think it's a win-win-win here. Drives more customers to you guys. It helps customers save money, and just societally, hopefully, incentivize more exercise. So we really are thrilled to be supporting you, and really want this to drive success for your business. I mean, our expectation of this materially helps your business, and is one of the best tools you guys have used. So again, sign up, get some emails from us. Um, let Ben and our team know if you have any questions, and we want to help enable you guys here. So we'll be in close touch.